Hello, everyone. Welcome to the Tech Symposium. My name is Ijeoma, and my life's mission is to build evidence-based health tech solutions for communities that are typically unheard, unseen, and disregarded in our current healthcare system, specifically the maternal healthcare system. I believe the key in building health tech solutions is simply by amplifying community voices. So I'm really honored to kick you off today, and I would like to start by telling you a story about Dr. Amani. My pregnancy was one of the loneliest and scariest times of my life. I struggled finding support from my community and provider, and it wasn't until I was rushed to the ER for a deadly missed complication that I finally felt seen. It didn't have to be like this. Unfortunately, stories like Amani's are not unique. In a nation as advanced as the US, how is it possible that we're currently in a maternal health crisis? Our maternal mortality rate is the highest amongst all industrialized countries, and shockingly, it continues to rise, having doubled in just the last 5 years alone. Pregnancy is getting increasingly more dangerous, specifically for Black women, who are 3 to 4 times more likely to die from childbirth, regardless of their education, their income, or any other socioeconomic factors. These statistics are glaring, and behind each number lies a tragic story of a loss and missed opportunity. The CDC uncovered that 84% of maternal deaths are preventable. So ultimately, we're failing to protect the lives of mothers and birthing people. These statistics reflect a deeper issue. Our healthcare system was not designed with equity in mind. It fails to adequately serve people of color, those with language barriers, and those who require alternative community methods, such as sign language. Yet, this problem extends beyond the immediate disparity. The very foundation of our healthcare system and medical research was constructed to cater primarily able-bodied, cis white men. According to CDC, in 2020, 75% of child participants of 53 new drugs were white, 11% were Hispanic, 8% were Black, and just 6% were Asian. It wasn't until June 10th of 1933, with the passage of the NIH Revitalization Act, that women was mandated to be included into clinical research. As a result, women are diagnosed significantly later than men on an average of 700 diseases, and in some cases waiting up to 10 years to get the right diagnosis. Women's health research has also been and continues to be hugely underfunded when compared to spending on conditions that affect men. A 2020 study found that almost 75% of cases with diseases primarily affecting one gender, the funding from the US NIH favored males. This means that diseases affecting women, like migraines, headaches, and endometriosis, or anxiety disorders, were often underfunded relative to their burden, while those affecting men were often overfunded. It also deprives the society of this funding discrepancy. Also, just describes the society because NIH is one of the largest single public funder of the biomedical and behavior research in the world. We see that funding trend flows into the tech world, where currently there's an untapped femtech potential of $1 trillion by 2027. And only 2.3% of current funding goes to women-led startups, and less than 1% go to women of color. So we are more likely to have heart attacks, react poorly to prescribed drugs, and have our pain and symptoms dismissed by doctors. Now add a layer of being a Black woman, or a trans Black woman. This disparity vividly illustrates the missed opportunity stemming from lack of representation and support for diverse voices within the tech industry. As an industry, we're perpetuating a cycle of inequality, hindering the realization of innovative solutions that cater the needs of all communities. This not only limits growth, but also deprives the society of groundbreaking advancements that could potentially impact health and the well-being for all. Because of these disparities, I became deeply passionate and committed to understanding how to address this crisis. I became fixated on unraveling its roots with its hope of crafting a tool that can prioritize the experiences of marginalized folks, starting with Black mothers and birthing individuals. This compelled me to co-found Birth by Us, a postpartum pregnancy digital platform empowered empower women of color to shape their own birthing experience with data-driven insights and community resources, while giving providers and hospital systems the necessary insights to best support their patients, as well as reduce the preventable maternal deaths and complications. The majority of digital health solutions have yet to be clinically validated due to a variety of reasons, like funding, resources, and the startup culture to build fast and break things. But the real change in people's lives happen with rigorously tested evidence-based solutions that are tailored to the specific needs of the communities we aim to support. But most importantly, solutions that actually work for the communities we seek to serve. Evidence-based health tech has a unique ability to accommodate the needs of different users in just one platform, including patients, families, healthcare providers, and researchers, while achieving the objective of payers, health systems, and influential organizations, and potentially shaping future, more inclusive national clinical guidelines. Looking at the current landscape, many health tech solutions are limited by the fact they are developing to only one stakeholder, either provider or the patient, which places a lot of weight on the specific stakeholders to take change to the outcome when it should be a collaborative effort. Healthcare in general has always been a collaborative effort. And BirthBy's quest to create a collaborative platform for Black mothers, we conducted over 250 interviews and focus groups, engaging with mothers and a diverse array of healthcare providers, including doulas, OB-GYNs, midwives, and maternity experts. What we discovered was profound. Our initial symptoms, based on literature research, failed to grasp the nuanced challenges faced in our communities. Listening to mothers, to the voices of mothers, we heard frustrations, fears, desires, and more personalized, empathetic care. They felt unheard, marginalized, and disempowered by their own healthcare journeys. We also found that in-person patient appointments did not work for mothers. They found it redundant and a waste of time. Many suggested using telehealth visits or monitoring systems. Similarly, healthcare providers, while well-intentioned, lack the cultural insights necessary to drive meaningful change, particularly in the Black community. Health providers and under-resourced facilities are often understaffed and felt like their care model could be more efficient, from receiving major concerns, mothers' concerns before the visit, or receiving consistent monitoring data to improve their ability to connect with moms and connect moms with resources that actually can address their needs. Doulas have been proven to have significant positive birthing outcomes, but are often underappreciated in the current traditional hospital system and struggle to navigate Medicaid coverage. Despite Medicaid coverage is a crucial role in covering a significant portion of 65% of Black births and 40% of all births in the US. After hearing their needs, we began building a comprehensive platform to address each issue systematically with a single accessible place. With these insights, we were on the mission to innovate with the community, not just for the community, to collaboratively build a tool grounded in health equity that could fill the gaps in maternal health. There are more phones in the world than there are people. So we saw a vast opportunity for technology to bridge the gap that we could be able to reach underrepresented communities that were being mistreated by the current system. Since our launch, BirthBy has garnered praise from mothers who report feeling empowered, informed, and connected to their healthcare experience. By centering a Black birthing experience and incorporating elements of cultural competency and inclusivity, we've designed a platform that resonates deeply with our users, which include birthing people, providers, doulas, and community organizations. Our work as innovators does not stop there. Community-first innovation is not just a buzzword. It's fundamentally shifting how we approach healthcare. It requires us to integrate technology with community resources, leverage telemedicine for remote access, forge partnerships with local organizations that have already been addressing underlying disparities. So we also have to be active participants in health policy and research in order to create sustainable solutions which will further complement us and sustain our impact. In recent years, the healthcare industry has seen a significant shift towards health tech solutions. Digital health has the potential to revolutionize healthcare delivery and truly improve patient outcomes. Digital solutions built on the foundation of diversity and representation, which serves all patients, must be informed by diverse perspectives and experiences to significantly improve clinical and operation outcomes. So I'd like to pause here and ask you to close your eyes and reflect. What are the experiences that have brought you where you are today? What is your vision of a world where healthcare system can fully incorporate the experiences and different identities into the daily practice? When I reflect, I think about the experiences that have led me here today. I think about my mother and my father who immigrated to the US from Nigeria and searched for a better life for themselves and their children. I think about how I'm worried for my sisters who dream of becoming mothers, but are forced to give birth in a healthcare system that consistently fails women who look like them. On the other hand, I think about my amazing mentors who come from all walks of life and bring their diverse backgrounds to help guide and fuel the work that we're doing at Birth by Us. I think of the stories we've heard throughout our journey of moms telling us to keep going because Birth by Us is helping transform their experience for the better. These are the things that give me hope that we can achieve our vision of reducing disparities and creating a beautiful, safe, and happy birthing experience for all women of color. Now open your eyes and ask yourself, are you doing everything you can to achieve this reality? Ensuring that everyone feels seen and heard in the current healthcare system we're currently engaging in. Take a look at who's using your health tech solution and who's on your team. If either lacks diversity, ask yourself what's getting in the way. As innovators, I believe our first job is to listen, then build. To navigate the world, we form mental shortcuts, creating habits. Over time, these cognitive patterns become ingrained, making it easier for our brains to operate in autopilot. This is reflected in our current landscape in health tech. We no longer adhere to habits that are deeply rooted into our biases. So it's important to find a way to slow our brains down where we are really hearing the needs of the people affected by the problem we aim to solve. Whether it's intentionally listening harder to people who don't look like you or making sure people in the room speaks at least once. My hope for a future is that innovators can recognize their own biases and work harder to educate ourselves and truly create a solution for all regardless of race, sexual orientation, gender, or a disability. I am also optimistic of the role of digital health and how it plays to guide unbiased care when built responsibly, and with diverse voices to minimize the effect of unconscious bias we bring as human beings to our work. We live in a world with diverse cultures and beliefs perspectives, so it's essential to recognize that diversity should be the forefront of every design and valued for its practical benefits. Diversity also enables teams to approach problems with multiple perspectives, gain a wider range of solutions, and better understand the needs of different populations. So if you take anything away from our talk today, it would be to surround yourself with people who don't look, think, or see the world in your lens. Many healthcare solutions are criticized for a one-size-fits-all model. So imagine a world where we have a new vision of personalized healthcare, where every individual's unique needs were met and with understanding and empathy. In order to achieve this, our innovations must work hand in hand with the community and built with the community, capturing a vast range of diversity within our society and ensuring the adaptability and adoption of these solutions. An inclusive design strategy is critical for creating digital health solutions that meet the needs of all people. As innovators, we must recognize the different roles we play in shaping a future of technology for our world. It doesn't matter how innovative your solution is if it's not accessible to the people who need it. When we have the responsibility to learn from the mistakes of the past and ensure that our creations serve and represent diverse communities we're a part of. This includes, for example, ensuring that your products are usable for individuals with disabilities and also have content in multiple languages. With an intentional and inclusive approach to product development, we can work towards a future where healthcare services are truly for all. As we build for the future, let us commit ourselves to the journey towards a healthier, more inclusive tomorrow, one innovation at a time. I encourage you to go through today with an open mind to the transformative possibilities that lie ahead, embracing every opportunity to learn, collaborate, and innovate for a brighter future. Together, we should continue to push boundaries and amplify the voices of our community, advocate for equity and inclusivity, and ensure that every person, in my case, every mother, anywhere in the world, receives the care and support they deserve. Thank you.